Hello, today we're going to be talking about attitudes towards participation in COVID-19 vaccination clinical trials and COVID-19 vaccination in Detroit, Michigan during the pandemic in association with the Department of Internal Medicine. So, vaccines for COVID-19 will play a crucial role in achieving herd immunity. A vaccine is thought by many to be a prerequisite for returning to pre-pandemic societal function. Clinical trials are being done to determine the safety and efficacy of a novel COVID-19 vaccine. These trials will have to recruit willing subjects who have given informed consent. Various studies on attitudes towards participation in vaccination trials, COVID and otherwise, like for instance Detac et al. In France for COVID specifically, and Sun et al. In 2014 in China for vaccine trials in general, have identified factors that predispose individuals to participating in such trials, and barriers or concerns that deter participation. At Ascension St. John Hospital, we are currently participating in one vaccine trial and will soon be participating in a second. We serve a population that has reason to feel skeptical about research participation and also skeptical about vaccines. Therefore, it would be useful to determine willingness to enroll in a trial and get vaccinated as well as barriers and concerns to these. Our research question here was to determine what factors predict willingness of patients at the Internal Medicine Clinic, or the IMD, and the Internal Medicine Specialty Clinic, the IMSC, which is the resident clinic, to participate in a COVID-19 vaccine clinical trial or to obtain a COVID-19 vaccination. Our methods here is we conducted a cross-sectional de-identified survey of patients seen at the IMSC or IMD over a 6-week period. Patients were given a survey by the front desk staff and asked to complete it while they were waiting for their appointment. A brief consent letter was attached to the survey, and filling out the survey was taken to indicate consent. We used a modified version of a survey about attitudes toward a potential SARS-CoV-2 vaccine that was given to a sample of U.S. adults previously by Fisher et al. Surveys included questions about characteristics previously identified in the literature as relevant, such as age, sex, and vaccine hesitancy. We also asked about previous influenza vaccination. Surveys were numbered so that we could compute a response rate. However, these were the ones that were not distributed were recycled before the PI could retrieve them, and therefore we did not compute a response rate. Data were analyzed using the chi-squared test, Student's t-test, and analysis of variance. A p-value less than 0.05 was considered to indicate statistical significance. So we ended up collecting about 206 usable surveys. In general, our respondents were about the age of 50, plus or minus 14.7 years as a standard deviation. The majority of our respondents were female. The majority of them were black. And the majority of them either had a high school diploma or an associate's degree or some college as their highest level of education. Their annual household income for the most part was below $60,000, and about half and half had received the influenza vaccine last year. The majority of them did self-report that their overall health was good. Moving on to our results, namely with willingness to participate in a COVID-19 vaccination trial, we identified 4 factors that ended up reaching statistical significance as far as factors that would deter or predispose somebody for doing this. Age was one. So a slightly younger age predisposed one towards trial participation. Male sex predisposed one towards trial participation. Race did not seem to play a role, at least in terms of statistical significance, but receiving your flu shot last year seemed to very much play a role, coming up with a p-value of less than 0.0001. If you did receive your flu shot last year, you were much more likely to participate in a COVID-19 vaccine trial. Having at least one comorbidity also reached statistical significance. If you did have at least one comorbidity of some kind, our survey did include things like diabetes, arthritis, cancer, respiratory disease, and hypertension. There was a p-value of 0.02. Suggesting that this was something that predisposed people towards participation. Other of those individual comorbidities, race, level of education, household income, self-rated health status, were not associated with trial participation. With regard to actual vaccine acceptance, now that there is, a choice of vaccines to get, Age, once again, played a significant role here with a p-value of less than 0.001. An older age predisposed you towards getting the vaccine. Sex did not seem to play as much of a role here. However, race did. White participants were more likely to get vaccinated with a p-value of 0.005. Having at least one comorbidity, once again, predisposed you towards getting the vaccine, with a p-value of 0.001 and about 47.9% of participants who said yes, saying that they would get vaccinated. Diabetes, interestingly, also reached a p-value of 0.02 as far as whether you would get vaccinated. And interestingly, if you did not have diabetes, you were more likely to get vaccinated. Otherwise, things like household level of education, household income, self-rated health status, heart disease, kidney disease, and other individual comorbidities like that were not statistically significantly associated with willingness to be vaccinated. Moving on towards our top reasons for hesitancy, both in participation and getting the vaccine itself now that it's here. Vaccine safety, effectiveness, and side effects in both categories were the leading reason that people were not willing to participate in either a trial or to get the vaccine themselves. And close behind that, especially when it comes to actually getting a vaccine, were lack of trust in vaccines and lack of trust in clinical research. These were also seen in clinical trial hesitancy as well. These are the fourth and fifth most prevalent reasons for not being interested in the clinical trials or the vaccines themselves, whereas fear of vaccines also came just behind those. Interestingly, about 7% had already had COVID in this particular survey. Looking here, one of the lower down reasons that are listed here is that they don't perceive a risk of getting COVID. Moving on, one of our other survey questions was, we asked them, what is the likelihood that you would guess that you would get COVID? And if you did get it, how serious do you think the disease would be? As you can see here, a very small percentage thought that they would get serious illness. A somewhat larger percentage thought that they would only get a mild case. However, the majority of people really didn't think that they were at any risk of getting the infection at all. Moving on. To our knowledge, this is the first survey of attitudes towards COVID-19 clinical trials and vaccine hesitancy done specifically in the Detroit area with a high proportion of Black African-American respondents. Our results were congruent with DeTalk et al. In that perceived personal risk made no difference to trial participation and that male sex and age were also associated with willingness to participate in a trial. Among the most important findings are the main reasons that our patients refused to get vaccinated and or participate in trials, as the big three were identical in both sections: safety, effectiveness, and side effects. Sadly, as noted earlier, lack of trust in vaccines and in clinical research in general were the fourth biggest contributor, well, fourth and fifth, really. Interestingly, while a lack of perceived risk was not high on the list of stated barriers, most people did not feel at risk of infection. The data help us to understand the issues to address with patients who are concerned about trial participation or getting a vaccine. Limitations here include that the survey format selected likely for those who are willing to respond, and this may have skewed the data to some degree. Also, 206 responses is really not as much as we thought we would get. We were hoping for something closer to maybe 600 to 800. And of course, compared to the overall population of Detroit, this is a relatively small sample size. And of course, our study was initially planned prior to any vaccines being approved under an emergency use authorization. And of course, by the time the study was actually distributed, there were multiple vaccines that were approved. And this may have skewed the dynamic a little bit by the time it had been done. In conclusion, our study found that factors associated with trial participation were younger age, male sex, white race, having received a flu shot last year, and presence of comorbidities, whereas factors associated with willingness to be vaccinated included older age, white race, having comorbidities, and the absence of diabetes. Over 80% of the respondents did not perceive a risk of becoming infected with COVID-19. Remember that this was done about a year after the start of lockdowns. Substantial concerns about vaccine trials and vaccination in general included vaccine side effects, safety, effectiveness, and lack of trust in clinical research. The combination of lack of perceived risk of COVID-19 and vaccine/research concerns demonstrate and important ideas for community education. Here's our list of research references, and thank you for listening and watching.